Okay, hello everyone. Hope you can hear me. My name is Osas, and welcome to this noise-induced hearing loss talk. We'll be talking about NIHL. It's largely aimed at employers, health and safety professionals. We'll be talking about referrals, HSE guidance, GP input, and to essentially help you feel better informed about noise health surveillance. So we'll get started. So a few years ago, there were some changes to the guidance when it comes to noise health surveillance. And one of them was how is audiograms assessed and categorized. Usually what we do is we would see the worker or the employee, we would do a noise health questionnaire for them, look at the previous exposure, any work noise exposure or non-work exposure to noise, look at the medical history, drugs, etc. We would then examine their ears and then conduct the hearing assessment. So since 2021, what we've been asked to do is once we've done the questionnaire, examination, the hearing assessment, we would then look at the audiogram, which I'll show you later on in the PowerPoint. But in this audiogram, we are looking to see any signs suggestive of noise-induced hearing loss. So if there are signs that are suggestive of noise-induced hearing loss, always progressive, then this worker would be in a category 3. Normally, we would then repeat the hearing test in a month's time or 3 months' time. And if they're still showing signs suggestive of noise-induced hearing loss, then they would be referred to the OH doctor. So essentially, this new guidance is to help OH people like myself to recognize early patterns of noise damage and to help employers prioritize risk control. It does say on the slide that NIHL must be confirmed by a doctor. So OH doctors don't diagnose NIHL. This is usually by audiology or ENT specialist. If we think somebody does have NIHL, we would ideally either refer them to the GP or refer or ask them to go to Specsavers or Boots where they can have a free hearing assessment, and the team at that department could then refer them onwards to a specialist if required. So what is NIHL? So essentially, it's permanent hearing damage caused by excessive workplace noise exposure. So what happens is you have the hair cells in the cochlea, which is this part here of the ear, and these hair cells, they don't regenerate. So the damage to these hair cells, they're permanent, they're not reversible. The sound signal, they can't get converted to nerve signals, and the brain therefore receives a weaker message. So the hearing is reduced for these employees, but also that they also may struggle to hear letters of certain words like the sh or the f consonants. So it's really important that NIHL is recognized early so that we can advise employers on better risk management in the workplace. I've also put here time as well. So it's progressive noise damage over several years usually. For example, to claim industrial benefits via the DWP for NIHL, you would need at least 10 years working in the noisy industry. And there has to be a certain amount of hearing loss to have occurred. And lastly, it is preventable with effective controls. And as long as we catch it early, as long as we see the signs early, we can hopefully advise on control measures. I'm sure we are all aware of the hierarchy of controls, elimination, and then at this point, it'll probably be engineering, admin, and then PPE. To also help with your risk assessment, you may also want to do a noise survey as well, where you would either use a sound level meter or a personal dosimeter, where you can see how loud the noise is in the environment, which tasks are noisy as well. So with NIHL, essentially what we're looking for is a notch. And over the years, what is a notch has changed. The Society of Occupational Medicine, SOM, they recommend the 4K notch. So if you see this audiogram here, you've got the frequency on the x-axis, and you've got the hearing level, decibels, on the y-axis. So anything above 20 is considered normal. And then as we go from 20 to around 40, 50, we're looking at mild hearing loss. And then from 50 to 70, we're looking at moderate. And then a bit beyond 80, we're looking at severe or profound hearing loss. Usually we would look for a notch in an audiogram first. So it would typically be the 4,000 hertz or 4 kilohertz notch. So as you can see, the hearing at various frequencies in the hearing test, it's normal. And then as you can see, it drops down in the higher frequencies, which is quite typical of NIHL. And then there's a recovery at 8 kilohertz. So that's what we call it, a typical picture of NIHL on an audiogram. And there are also several causes of a notch as well. So typically when you are exposed to noise in the workplace, both ears are going to be exposed at similar levels. So if we see a notch in one ear, but not the other ear, it still could be noise, but it could also be many other causes, such as drugs or head injuries or even tumors as well. So it's really important that when we see a notch, to get referred to the OH doctor and we take a good detailed history about their medical history essentially and see if there's any potential causes of this notch, or is it just noise. So why does it matter in the workplace? So a few obvious reasons: safety. If you've got reduced hearing or if you've got noise-induced hearing loss, your ability to hear alarms or machinery or instructions in the workplace is reduced. And naturally, that could contribute to errors and accidents in the workplace. So what I do usually is I would suggest that a functional assessment is carried out in the workplace. So this requires essentially a senior manager or health and safety observing the employee and just doing a small test in the workplace to see that can they hear appropriately, are they able to respond appropriately, and if they can do so, then they would be considered safe to be in the workplace. It's very rare that we completely restrict employees working in the noisy environment if they've got NIHL. With NIHL, it can also be considered as a long-term disability as well. It could, if severe enough, it could affect not just the work life, but also their personal life as well. And some employees have brought personal injury claims in the past. I do have a few cases to discuss at the end. But with NIHL, it's very important that it's taken seriously. It's the second most common reason for employers' liability insurance claims as well. So as long as employers know about it and they comply with the legal requirements to help manage the risk in the workplace, conduct hearing surveillance, review the risk assessment regularly. You should hopefully be on the right track. But importantly, this is all governed by the Control of Noise at Work Regulations 2005. And I'll discuss a bit about this later on, but essentially it oversees what we do and what the employer should be doing. So we have had people ask in the past, why am I here? Why am I seeing occupational health? I can hear fine. Let me get back to work, etc. But just, in the previous slide, I talked about the Control of Noise at Work regulations. It is part of the employer's duty to conduct hearing surveillance when there is a risk of hearing damage to the employees. When it comes to noisy environments, so in the regulations, they talk about anything more than 80 decibels. They should be offered hearing protection, and anything above 85, hearing PPE should be mandatory. Typically, you would do a baseline hearing assessment when someone starts, and if it's normal or if they've got mild hearing impairment, you would just repeat it again the following year. And if that's still okay, then it will be every 3 years. But with Insight, what we have noticed with a lot of our clients is they do an annual check regardless of if it's normal or abnormal. And I like this approach because a lot could happen in a year when it comes to the workplace or the tasks that they do or the environment. And a lot could also happen to employees' health as well. So if we do it on a yearly basis, it helps us detect any subtle changes. And the earlier that they're seen, the earlier we can provide intervention, whether it's advice on control measures or a referral to the GP or to the audiology services. So again, what we're looking for, so typical, we do a usual history, examination, we look at the audiogram, and we look at the frequencies from 0.5 kilohertz to 8 kilohertz. We look for a notch. Now, that's primarily what we're looking for. We're looking to see if there's any signs of noise-induced hearing loss, but we also looking to see if there's any other signs of hearing loss or different patterns as well. So it could be different diseases, could have different hearing patterns on an audiogram. Age linked hearing loss could also show a different pattern on the hearing audiogram as well. So there's different causes of hearing loss. What we are looking for essentially is if it's caused by work, if there's any signs of NIHL, if there's any signs of any deterioration year on year. We normally say any deterioration of more than 10 decibels at any frequency, I would say that they'll probably need an annual check on a yearly basis, really. And doing this hearing surveillance on a regular basis, ideally yearly, it just allows us to also check if the control measures are working. And if not, we can hopefully advise better on the control measures. When I do ask about how is noise controlled at work, a lot of the employees, they go straight to the PPE side of things. But as we know, that's usually the last line of defense. So we want to make sure that not only can the employees use their PPE correctly, looking for any defects, making sure that they're trained to use them properly. But it's also a chance for us to educate the employee as well, and to hopefully advise the employer if there's any further control measures that they could use as well. So as I said before, the notch is quite important because it gives us the first indications or the first signs of NIHL. Usually the signs come on before the symptoms. So a lot of employees can usually get by in work okay, even with early signs of NIHL. But over time, without any intervention, the hearing loss will gradually get worse and worse and worse. So, but as long as we, again, intervene early, advise the employers on reviewing the risk assessment for noise on a regular basis, looking at the controls, it should hopefully prevent NIHL from getting worse. And as I said, they wouldn't be restricted from work straight away, but they should be reviewed on a regular basis. And we want to make sure that the noise, that the hearing loss isn't getting worse and worse. Because as we know, with the hair cells, once they're dead, they won't come back. But what we can do is we can stop it from getting worse and worse. And of course, if we can intervene early, it also reduces the risk that an employee will come through with a personal injury claim as well. So again, it's just really important that we follow the process through. When somebody has signs of hearing loss, whether it's NIHL or something else, they should still ideally be reviewed or referred to an OHP doctor. We have had a few occasions where employees have had reduced hearing on the hearing assessment, and we have advised that they are seen by the doctor, whether that's from occupational health or a GP, but unfortunately it hasn't happened. So if managers could essentially help employees and prompt them to always attend these health surveillance reviews, that would be for the best as well. It just protects the employers, it protects the employees, and everyone will hopefully be safe at work. And it will help the employees as well as keeping people safe at work, but it will also help them comply with the legal obligations. So with GPs, they see a lot of different things, of course, but what they don't see is occupational causes. They, whilst they know about hearing loss and different types of causes of hearing loss, they're not trained in occupational health. They probably won't know about the control of noise at work regulations. They probably won't know about noise risk assessments or control measures. They've also got 10 minutes as well with the patient. So most of the time, if a GP input is required, that will be from occupational health to advise instead of the employee bypassing occupational health and going straight to the GP. I'd also imagine that your GP probably wouldn't know much about NIHL as well, or even how to interpret it or how to advise on risk controls. But with occupational health, we of course know about NIHL. We have a direct communication with the employers as well. And with GPs, because hearing surveillance isn't really part of the NHS work, GPs can decline to get involved. They can reject the work as well. So it's really important that occupational health is involved. If we think a GP should be involved, we would let the employee and the employer know. One of the reasons we would want the GP to be involved is if there is a large difference between the right ear and the left ear. Another reason is if the employee has symptoms such as hearing loss that's been quite sudden, out of nowhere, or they've got a lot of pain, or they're feeling very dizzy, or any ringing sensations, or any discharge. then we would advise the GP gets involved. But when it comes to NIHL, that should be from the Occupational Health Department to lead. So I hope so far you've understood what we do about noise hearing surveillance and what our role is. When it comes to the categories of hearing surveillance or of hearing levels, you've got category 1 to 4. So category 1 is normal, category 2 is mild hearing loss, category 3 is poor hearing or severe hearing loss, and category 4 is rapid hearing loss. There is a separate category which could be category 5, or it could be called hearing loss, like a large hearing loss between the right and the left ear. But what we're more concerned about from this talk today is NIHL, which is going to be category 3. What we also can help on is recommendations on control measures. We're not health and safety. We may not be able to give you the exact specs of hearing protection, but we can suggest ways to help improve noise control in the environment. So just going back to the control of noise at work regulations. So again, this is a brief summary of what we've talked about so far. So employers should be doing a noise risk assessment, providing hearing protection and training, and ensuring that any employees that are at risk of hearing damage, that they undergo health surveillance, whether it's on a yearly basis or through the standard process. When it comes to the HSC, we know about what they can do. They could turn up to your workplace unannounced. They've got the powers to come to your premises at any reasonable time without any notice, to look at inspections, to see if you're complying with the regulations, especially when following up on complaints or accidents. And they can issue improvement notice or prohibition notices as well. So as long as we look at the guidance of noise hearing surveillance and the control of noise at work regulations, as long as we stick by the guidance, I don't see any reason why any employer should have any problems with the HSC. So what we are asking from you is essentially what was on the previous slide. So just following the guidance, making sure that you are adhering to the guidance, and making sure that the employees who need surveillance are getting the surveillance and going to the appointments as well. It's important that ideally, if you can, try and follow our recommendations on the report, which would usually be about maintaining or improving the control measures in the workplace. If possible as well, you could also offer toolbox talks to the employees. So this helps to essentially reinforce safe work practices and ensuring that the employees are always compliant when it comes to hearing protection. So a few cases. So in 1984, there was 6 shipyard workers who were exposed to a lot of noise. However, 10 years prior to that, they were provided with hearing protection. But in 1963, there was a book published which talked about the dangers of workplace noise. And this had I believe, it had a legal effect of putting employers on notice of the dangers of workplace noise. So essentially, this case is essentially saying that from 1963, employers should have been aware of noise damage for employees if they're exposed to a lot of noise in the workplace. So there's no excuse now for employers to not know about noise damage. It does happen, and employees can suffer the consequences. I believe these 6 workers were awarded compensation as well. And another similar case again. So this was a viola player that was sat in front of a brass section, and in this case, now this person did suffer an NIHL, but what this case is saying is that the risk of injury through noise is not removed simply because noise is the deliberate and desired objective. They want to create noise in the opera house, but they still need to make sure that their employees have their hearing protected. It doesn't matter if noise is the desired objective, they should still ensure that their hearing is protected. So a few key takeaways today. I think the main thing is NIHL is important. It's preventable, and if we can catch it early, we can hopefully prevent it from getting worse and worse. Hearing surveillance is not optional. If your noise risk assessment deems it to be required, then it should happen. And when it comes to GPs, as I said earlier, they're not always the correct pathway. We would advise on when a GP should get involved, but it's really important that if an employee needs to be seen by an OH doctor, they are seen by an OH doctor, because we had the expertise and the experience in dealing with noise-induced hearing loss and hazards in the workplace, unlike a GP, for example. And I want to just sort of finish off by saying that if your workplace is loud enough that you have to shout, you know, it's a hazard. You know, if you have to shout across to get someone's attention, it's a hazard. It's really important that a noise risk assessment is carried out and it's reviewed on a regular basis. Any changes to the workplace or to the work environment or to the task or to the process, make sure that the noise risk assessment is also reviewed as well. So I hope that was helpful